Hello everyone, this is Kripa Sigdale and you are listening to Psychbigyaan Interview. Psychbigyaan Interview is an activity of Psychbigyaan Network Nepal where you try to interview various people related to mental health and psychology. Regarding that, today we have Mandy, Peacock and Carla White, who are recent graduates of the postgraduate occupational therapy course from London South Bank University. They are also soon to be registered occupational therapists. Actually, occupational therapy is a new topic to us, is a new subject in Nepal. So today, with the help of our guest and in this episode, we'll try to explore more about occupational therapy, its treatment, its purpose, its areas, and occupational therapy as a whole. So without further ado, let's get started with our interview. Welcome to Psychbigyaan Interview. First, I would like to start with Mandy. What occupational therapy actually is, and can you please explain a little bit about its history?
The history. Well, thank you very much for asking us to have a chat with you today about occupational therapy. Just to give you an up-to-date in terms of occupational therapy as it is now, within the United Kingdom where I have trained, there is over 36,000 occupational therapists, but it is a worldwide profession, and there's over 420,000 occupational therapists in the world as we speak. Occupational therapy as it is now is very much focused on occupation, and what we mean is occupation isn't about your job. It can be things that you do every day of your life, for example getting out of bed in the morning, cooking or cleaning. So that's the background in terms of what we mean by occupational therapy today. And occupational therapists today are very much involved in trying to make sure that the individual is occupied, they're busy in their day and they're doing things that are meaningful to them. Historically, it was actually very different in the past. And people, for example, who had a mental health illness in the past, more than 200 years ago, they would be often locked up, they would be in prison, and they would be treated quite poorly because of their mental illness. They would be suffering brutality, punishment, and they would be idle, they wouldn't be doing anything. And then about 200 years ago, things started to change, and this moral treatment movement occurred. And what they thought then, in terms of treating people with mental health difficulties, was not idleness, was to actually give them things to do, things that were meaningful to them. So over time, it's gone from treating people with mental health illness in terms of locking them up and them doing nothing, to now people with mental health, in occupational therapy terms, they're not locked up. They want to be encouraged to be part of society and have a meaningful and purposeful life within society. And occupational therapists today, what we're involved in is trying to maximise people with mental health illnesses, their independence in society.
Okay. Mandy, do you know? Can you tell us about who initiated it?
The moral treatment movement.
Yeah.
I don't know the two, and there was two particular individuals who started that moral treatment movement. I don't know their particular names.
But it started 200 years ago.
Over 200 years ago. It came more to the fore after the First World War in England, for example. Within the UK, it became more to the fore because what happened is, in the First World War, a lot of soldiers were returning from France, coming into England and the UK, and they were traumatised. And when they were in hospital as a result of being traumatised, people needed to treat them.
Right.
And one of the things that people were doing to treat people after they'd come back from the war was to keep them occupied. And workshops developed in hospitals which would be enabling people to be treated by doing things. So that's more recently in sort of the early 1915, around that time. So that's more recent history.
Okay. I would like to move to Carla. Occupational therapy is called client-centered therapeutical technique. So what does that mean?
Well, hello. Thank you for having me as well. So the client-centered approach which occupational therapists use means that the client or the patient is held at the centre of all that we do. Occupational therapists approach each person as a unique individual, and we take a very holistic view in understanding this individual, taking into consideration their environment, how their presentation is, their values, their beliefs, being very holistic with them. And each occupational therapy intervention is designed and delivered with the values, beliefs, priorities, goals, wishes and needs of the patient, taking into account their strengths and weaknesses. And it's not a one-size-fits-all approach. It's not like prescribing medication. The patient and the therapist in client-centred practice also work together to set goals. They collaborate, the therapist and the patient collaborate together. And it's been shown that if the patient takes part in the planning of the occupational therapy interventions, then research has shown that the patient may adhere more to the therapies and therefore making the therapies more effective and successful in meeting their therapy goals, working together with the client.
Okay, so client would be the master of the therapy.
Yes,
be leading.
it's often said that occupational therapists will facilitate and support the therapy
client
itself rather than leading it and delivering it. The patient becomes very active in their therapy and not being in a passive role as with other approaches.
Okay. Then Mandy, I would like to know what areas are addressed in occupational therapy treatment.
Right. Occupational therapists, whether somebody is a mental health illness or a physical disability, we have models of practice that we use, and the models of practice are used in order to help individuals. How we look at them in terms of occupation is we are looking for occupation, and how we have it is about three areas really. One is self-care, the other is leisure, and one is productivity. So they're the three areas of occupation that we will be looking at. Self-care is things like getting out of bed in the morning. It could be preparing your food. Leisure is things like singing or dancing or reading or spending time with your family. And productivity could be your work. So they're areas that are very important to occupational therapists. Other area that we're looking at is when we do our things in our daily life within a social or a physical environment. So for somebody who has, for example, a physical disability, we're looking at the environment to see whether their wheelchair will be suitable to get into that building. Right. For somebody with a mental health difficulty, their social environment could be really important. What support network do they have? Are they stigmatised within their social environment? So occupational therapists would be looking at that particular area too. So they're sort of the main areas that occupational therapists would be looking at when we're trying to support somebody, for example, with a mental health illness.
Okay. And then Carla, can you add or can you explain something about the purpose of occupational therapy? What are the purpose of occupational therapy?
Well, that's a very interesting question, and I think throughout occupational therapy it's always been a challenge to try and define it in a very short way. To put it simply, occupational therapists help people through doing. Occupational therapists work to increase and improve a patient's ability to function in life and maximise their independence. Occupational therapists use the participation and engagement in meaningful activity as a tool and as a catalyst for therapy. We play a critical role in helping people of all ages to overcome the effects of mental and physical impairments so that they can carry out everyday tasks and activities. And occupational therapy provides practical support to enable people to facilitate recovery and overcome any barriers that prevent them from living a meaningful life. And occupational therapy involvement helps to increase people's independence and satisfaction in all areas of their life, again using that person-centred approach.
Okay, that means occupational therapy basically enhances the quality of life and make it meaningful.
Yes, and really improving the levels of independence is really a core principle of occupational therapy as well. Yeah. Okay.
So we talked about occupational therapy, we talked about its purpose, we talked about the areas addressed by occupational therapy, and I guess there should be some particular process in the occupational therapy. So Mandy, would you like to explain about the particular process in occupational therapy and who benefits from this process as a whole?
Right. The occupational therapy process does follow quite a standardised system which we will follow. The first thing is to actually get to know your patient, find out what's important to them. So the first stage is information gathering, and we do that by assessments. we're constantly assessing an individual, so we're finding out information, we're assessing them. So we have what we call an initial assessment, and then we have repeated assessments because people change over time. So we have the initial assessment, and that's a partnership working between the occupational therapist and the individual to find out what's important to them, what's important in their life that they want to be able to do. Either maybe they've been in hospital a long time because of acute stages of illness, and they've maybe become de-skilled. So we're finding out what's important to them. So that's the first process. We are also using, when we're doing this, we're using standardised procedures, because a lot of our assessments we will use at the beginning and at the end to measure how the impact of the occupational therapy, has there been a change as a result. So we're using standardised assessments. When we're interviewing the individual, that's one of the ways that we can talk to them, but we can also be doing what we call observational assessments. We can watching them in a room to see whether they're withdrawn or they're engaged socially, if they're participating. So we use a lot of observation as well. And because it's a holistic profession, we're also finding out information from the family members, their support network. Right. So it's a lot of information gathering. So we're speaking to the significant individuals in the person's life. Particularly if they're in hospital, we want to be able to find out what their social situation is at home. Once you've had these assessments, then what we do is goal setting, and that's a really important, crucial part of occupational therapy. And on the basis of the assessments, we create a plan together with the individual, and we try and work out what their short-term and their long-term goals are. And it could be, for some person with a mental health illness, because they're lacking motivation and they're not doing very much during the day, it can be just to get them motivated again. So the short-term goal could be to get up in the morning at a certain time to be able to actually meet with the occupational therapist and maybe have breakfast. That could be a very short-term goal. And then the long-term goal could actually be that they don't need to be prompted to get out of bed in the morning. They're getting up and they're doing things. So we talk about short-term goals and long-term goals. That's the second stage of the process. The intervention, the treatment, is the thing that we do with the individual. And what's very important with occupational therapy that you always need to remember is our treatment, our prescription is occupation. So we'll be doing something together with the individual. We can be talking with them, but it's not like psychologists, which are talking therapy. We're a doing therapy. So we'll be doing something in terms of our treatment. And what we're trying to do there with that treatment is to create the ability for the person to be as independent as possible. And then evaluation is always important. That's sort of one of the other steps in terms of occupational therapy. We're always checking to make sure that the treatment that we're prescribing with the individual is working. And if it's not, we will think about other ways to be able to enable them to maximise their independence. And then hopefully, at the end of the process, will come discharge. And that's a really important part of the occupational therapy process, particularly if you're in a hospital setting, because what you need to be able to hope is that when they're discharged back to their home environment, that they will be able to successfully carry on the good work that they've done in hospital and hopefully prevent readmission because of a relapse. So we're very much involved in the discharge process to try and bridge the gap between hospital and home. And that's a very important part of the role that we do. So that's a very whistle-stop tour of a OT process.
And then those are the particular processes. Mandy, I would like to know about. How important is other disciplinary in occupational therapy.
So for the multidisciplinary team approach, now I'm very happy to talk about that. The multidisciplinary team, it's a really important part of the occupational therapy process. That individual is supported by many professionals, and the multidisciplinary approach, we're obviously communicating with each other for the benefit of the individual to try and find out. For example, the psychologist might say, the clients just told me that they really like playing a guitar. Did you know that? Because that might be something that we can use to support them in terms of meaningful activity. So communication with the team is really important. Where it's particularly important is going back to this question before about discharge planning. MDT working is really important on discharge, because what you all as professionals want to make sure doesn't happen is a relapse and a readmission to hospital. And because one of the areas that occupational therapists are very focused on is the environment, the institutional environment or the social environment, we're often the people who will go out of the hospital into the client's home, speak to the family, see what's happening, and then be able to try and support the transition from discharge back to the home environment. And then we can be feeding that back to the MDT and saying, well, we've been to the home environment, we've spoken to the family, these are the things that we think might be barriers to a discharge, and we will share it with the MDT in order that as an MDT we can help the individual hopefully have a successful discharge.
Right, that would be more effective.
Yes.
And then Carla, how is it different from other kinds of psychological therapies?
Well, I think as Mandy said, it's different from the different psychological therapies, but it's very much a collaborative effort, and we all need to work together. For instance, psychiatrists will prescribe medication, physiotherapists may prescribe exercise, psychologists may prescribe talking, very simplistic terms, and occupational therapists will prescribe meaningful and purposeful activities and being engaged and participating in these activities. The OT's approach is to complement the medical model, but it is different from the medical model. We use our own models of practice. And occupational therapists will focus not on removing the symptoms and removing the impairments and curing. Rather than this, we will look at treating the. We will work with the patient to live independently and to maximise well-being and quality of life, even despite the illness itself being present. We won't look at removing the symptoms or curing, we will look at living with that condition. And we will work with this on a holistic level to increase the quality of life, well-being and independence. And one nice simplistic statement to highlight the difference is that occupational therapists will ask, what matters to you, not what is the matter with you.
Okay, what matters to you, not what is the matter to you.
Yes.
Right. Then I would also like to know about who are the real beneficiaries of occupational therapy treatment.
Well, I'm going to be biased because obviously I'm very passionate about occupational therapy, and I'll say everybody. And I think it comes back to the actual model, and our model is not just looking at the individual who's the centre for us, the person-centred, but also because we're looking at the social environment, it's the family, and often, particularly with mental health difficulties, the family can also be finding it very difficult to either support the individual or understand why they are the way that they are and what help that they may need. So occupational therapists would be supporting not only the individual but can also be supporting the family, or for example if the person's in employment and the employer's finding things difficult with in terms of working with the person who's got the mental health difficulty at the time, we could be working with the employer too. So that's the sort of, because of the fact that we're always looking at the social environment too, that's why I think everybody would benefit. In terms of our client group, we can be working with children right up to people who are close to death. It's a very broad client base that we work with.
So you mean to say basically everybody benefits from occupational therapy treatment?
Absolutely. We can treat everybody. We can specialise in particular areas.
Okay. Mandy, I would also like to know, like we generally say, occupational therapy is in mental health rehabilitation. Is it similar to the physical disability rehabilitation?
Our core principles are the same. Our core principles about how we would work with an individual is the same. But obviously what you actually do in terms of treating that person would be different. So, for example, with somebody with a mental health difficulty, often what we find is that they are isolated. They're very isolated. So, for example, if I give you an example for somebody I've worked with in the past, I work with young people between the ages of sort of like 18 and 21 who had schizophrenia. They felt very socially isolated. So as an occupational therapist, what we were trying to do was build social networks for them. So what we would be doing there is we would be asking a group of individuals, young people with schizophrenia, who felt very lonely and withdrawn and not supported, if they would like to join a group of other people of their similar age, and we'd have activities, we would have outings, and we'd have cooking sessions, so they felt that they weren't on their own, they weren't the only one. And what we're also trying to do there is support not just the individual, but also their family, so that they're not totally reliant upon their family. So when you're working with a person with a mental health difficulty, it can be a lot to do with like social withdrawal and trying to increase their social circle. It can also be to do with increasing their motivation. Now that can be very different to somebody who's got a physical disability, for example, who's had a stroke and can no longer walk and has maybe right side. That would be a very different approach. An occupational therapist in that situation would be trying to give them practical advice about how to put your clothes on in a different way. If you're, how to be able to access a building in a different way. So that we can work with different individuals, but often with mental health, it's to do with social isolation and motivation.
Okay. And then we talked about occupational therapy is basically doing. It's more into doing than talking or other techniques. So psychosis patients, as you know, are functionally and mentally impaired. So in such cases, where does occupational therapy treatment fit in? What do you think?
Just repeat that question, sorry.
Like occupational therapy is more into doing. We say psychologist focuses on talking, but occupational therapy, it focuses on doing. So, but psychosis, as you know, psychosis patients are functionally and mentally impaired. So where does this occupational therapy treatment fit in that condition?
We always say that a person, no matter what their diagnosis, is capable of doing something. And that's where one of our skills is to do with what we call grading. So we might actually start with something very small in terms of an activity. So I'm trying to think of a good example that we could use.
Maybe like graded approach to the length of a session. So for instance, someone with psychosis, perhaps they might not be able to concentrate for so long. So rather than having a 30-minute cooking session, you could do an approach where you build it up from 5 minutes to 10 minutes and gradually building up to 30 until they can make the whole meal themselves, for instance. And that goes in line again with maximising independence and quality of life and functioning to their full potential.
Great. Yeah. Carla, I would like to ask you something. How does occupational therapy treatment help to maintain the dignity of mentally ill people?
Well, as occupational therapists, we're very pleased that dignity in mental health has really gained traction and really come to the forefront of mental health practice. It's something that's really been needing to happen for a long time. So going back to what we said at the beginning about being client-centred, patient-centred, that in itself is promoting dignity. That's listening to the patient, listening to their needs and wants, listening to what their goals are, working together, giving them a sense of ownership of their own therapy process. So that's giving them dignity through that. Also, I see dignity as being closely related to quality of life. I feel that enhancing quality of life brings about a sense of dignity, and a sense of dignity also enhances one's quality of life. So in mental health settings, occupational therapy will often aim to improve and enhance the quality of life for patients undergoing treatment for a variety of different mental health illnesses. And quality of life can be self-reported and is subjectively understood by patients, and can be understood as being separate and yet connected to the symptomology, to the conditions. And we work with the premise that quality of life may be improved and maximised even with the symptoms of mental illness being present. And the World Health Organization includes quality of life and well-being in their concept, in their definition of health, which moves beyond the idea that health is a state purely judged on disease and disability. And mental health promotion and the promotion of dignity in mental health is concerned with improving quality of life and well-being, not purely removing the symptoms. And occupational therapy can improve a patient's self-image, increase confidence and enhance the sense of belonging to the community by and also providing opportunities for patients to make choices, enjoy a sense of control. And for me, this understanding of all these concepts together is really intertwined with dignity and promoting that dignity. And one further thing on a practical level, I would say that, for instance, a lot of patients, they might have a goal that they want to dress themselves, or they want to wash themselves, or go to the toilet themselves. They don't want their family members maybe doing certain private, personal things, especially maybe if they're teenagers, young adults, these things. So for them, dignity may be, I want to be independent in doing this because I want my dignity, even within the home environment, before they step outside to the outside world. I want my dignity and I want to learn how to do this and have some control over their life. Yeah.
Right. Mandy, would you like to add something in that? How does occupational therapy help to maintain the dignity of mentally ill people?
I think it also helps to reduce stigma.
Right.
Because if you are able to see that people with mental health conditions are able to live a meaningful life and lead an independent life, then I think that will ultimately help in stigma. And I think many countries, even countries as like the United Kingdom, there is still a lot of stigma in terms of mental health. And I do think the more that we are promoting independence and people having an active life and a participating life within society, then stigma will reduce.
And then gradually dignity of mentally ill people will be enhanced.
Yes.
So we talked about many things regarding occupational therapy, about the treatment, about the purpose, about the areas it addresses. So at the end, is there anything we left in the interview which you want to add, Mandy?
Just to say really that on the 7th of October, just repeat that, the 27th of October 2015 is World Federation Occupational Therapy Day, and it's a really useful opportunity to promote occupational therapy and occupational therapy in terms of mental health, and also occupational therapy in terms of physical difficulties. And the World Federation of Occupational Therapists is an international voice of the OT profession, and it covers 80 countries. So it's just a really great opportunity, I think, to increase awareness of OTs, what we do, and just to promote the fact that occupational therapy and what we do can have a truly global impact, I think.
All right. So, Carla, is there anything left?
I think I just want to reiterate the key message of what we've been speaking about today.
Shall we say it together?
Yes, occupational therapists. We help people through doing. We make doing doable. Hey.
We had this wonderful talk. We talked a lot about occupational therapy. This is a complete new topic or new therapy technique in Nepal. So thank you so much for introducing it. We'll be definitely talking more, or definitely be getting in touch with you guys in occupational therapy, World Occupational Therapy Day on 27th October. Till then, thank you so much.
Thank you very much.